COVID situation in the country. India on Thursday reported at least 3,303 new coronavirus cases. According to the Union Health Ministry, the active cases increased to 16,980 with 701 new active cases in a 24-hour time span. The active cases comprise 0.4% of the total infections, while the national COVID-19 recovery rate was recorded as 98.7%. Delhi on Thursday continued to witness over 1,000 cases after 1,490 people tested positive for the infection, up from 1,367 on Wednesday. According to the health bulletin data, the capital reported fresh fatalities as well. There were 2 fresh fatalities. Dr. Ishwar Gilada is joining us on the broadcast to help us understand the gravity of the situation. A very warm welcome to you, Dr. Ishwar Gilada. Help us understand. We saw a decrease in the number of cases. The mask mandate was lifted off. But as soon as the mask mandate was lifted off, the cases started rising again. Does this serve as a reminder to all of us that the masks are here to stay?
Number one, the cases which are escalating, they are very few, far and in between. Number two, mask mandate has been lifted almost 2 months back in most places. Number three, there have been lot of socialization, social gatherings, the Holi, there were elections in 5 states. People are traveling chock-a-block full, whether it's a flight or bus or train. Despite that, escalation in numbers is not very high. But most important thing we should look, and you also said that recovery rate is 98.76%. That means the trajectory of infection, whatever number of people who are coming positive, how many of them require oxygen, how many of them require bed or ICU or ventilator? Very few. Hardly 1%, 2% people land up in hospital. The case fatality rate, which used to be 2.1% earlier, then became 1.3% pan course of 2 years, is currently 0.2%. Please don't go by number of deaths occurring in the country on record, because they are showing 33, 35, 39. Most of these deaths are from Kerala. They are updating their old record. So for last 8-10 days, Kerala is reporting almost 25-30 cases per day, deaths per day. But in India, in rest of India, deaths are only 4 or 5 or something. So that is 0.2% case fatality rate, which is very close to case fatality rate of flu, which is 0.1%. So COVID is currently behaving just like a flu. If we are not bothered about flu, I don't know why we should be bothered about COVID. Number 3, cases will go up. We should not be bothered. Cases will come even from school. School should not be closed, because already children suffer for last 2 years. There are a lot of mental health and medical problem with the children of not going to school. So psychological mental health problems are more severe than risk of getting COVID, and that too in children it is not severe. Most importantly, we should start vaccinating children as early as possible. Number of children to be vaccinated are hardly 10 or 11 crore. India's capacity to vaccinate is almost 2 crore per day. We can do that entirely in 1 week, provided number one, we involve pediatricians, number two, we involve clinics and nursing homes, because parents and children, they have a better rapport with their practitioners and pediatricians. In that way, vaccination can be done faster. And we have been demanding for a long time the gap between the second dose and a precaution dose, which was 9 months, should be made to 6 months. They are already deliberating that, but I think probably announcement will come very soon. Once that is done, people should start taking precaution dose. Most importantly, vaccination is very good when COVID or any infection is lying low. It is not good when it is lying up, because if you are vaccinating when the COVID or any infection is at the peak, at that time you do not know whether that person is already infected with COVID or hibernating COVID inside his blood. And in that situation, by giving vaccine, you are challenging that person to go into cytokine storm. So this is the best time to get vaccinated. But unfortunately, our vaccination is proportional directly to the masking. As soon as masking goes, masking is up, people go for vaccination. As soon as numbers are up, people go for vaccination. When the numbers are down, mask is down, people are not going for vaccination. And most importantly, your question, masking is required only in public places where there is a lot of crowd, in public transport, in hospitals, in clinic, and in closed door places where you are sitting in restaurant and theater, etc., or mall. So I think actually masking is not required pan India for everybody at home in their day-to-day practice at all.
All right, Dr. Ishwar Elata, there are also concerns that the fourth wave is here. So, what do you have to say to those claims?
See, fourth wave is not in the sight. If at all, there will be some ripple, but there will not be wave. This fourth wave scare has been created by non-medical, non-public health people like IITians. And same IITians group earlier had said that a second wave was not going to come. And you have seen what kind of devastation happened to the second wave. They call themselves Sutra model and they call National COVID Projection Council government-sponsored body. And government believed them. Now IIT Madras also saying something. So I think we should not believe in these people because they have no public health background. COVID is not a mathematics or statistics. And statistics do not make you laugh and figures do not make you cry. It's a human suffering which is important. So let us understand one thing. It's a public health problem to be dealt with by a public health expert. And ministry or health ministry should give credence only to those people which are in the know of COVID and understanding. Not only because of some calculation and projection. So I think fourth wave is not going to come. Don't look at the east. Don't look at the west. They have different reasons why the escalations are there. In India, currently 90% of us have at least natural immunity. 78% of us are fully vaccinated. That means 85-86% of us have a hybrid immunity. And 95% of us have some immunity. So only 5% of the people which are vulnerable, even if the concept of herd immunity doesn't work, the vulnerable population is small, and that too that contains a lot of children. So once we vaccinate children, I think that population will be reached to around 98-99% and will be in much safer zone. But don't worry about fourth wave at all.
All right, Dr. Kishwar, stay with us. I'm also joined with Manohar Kesri, who's joining us from Delhi. Manohar, take us through the COVID situation in Delhi. What are the numbers like?
देखिए, बिल्कुल दिल्ली में लगातार मामले बढ़ते जा रहे हैं। अगर पिछले एक हफ्ते की बात करें तो 95% जो है तो केसेस ज्यादा बढ़े हैं और अगर हम 24 घंटे की बात करें तो तकरीबन 1500 मामले दिल्ली में आए हैं। तो इस तरह से आप स्थिति देख सकते हैं किस तरह से दिल्ली में जो पूरे देश के मामले हैं उसके तकरीबन 50% मामले जो है दिल्ली के हैं। तो दिल्ली सबसे ज्यादा वनरेबल हो चुका है। लेकिन हाँ, एक अच्छी बात है कि अस्पतालों में लोग कम जा रहे हैं। आईसीयू के बेड्स खाली पड़े हुए हैं, बहुत कम, रेयर से रेयरेस्ट जो है। लेकिन जो पॉजिटिविटी रेट है वो पॉजिटिविटी रेट लगातार बढ़ती जा रही है। अगर आज की हम बात करें तो आज देश भर में कमोबेश कल की ही स्थिति रही है। 3337 मामले आज आए हैं। लेकिन जो डेथ रेट है, डेथ की संख्या आज कल के बनिस्बत करीब करीब दोगुनी हो चुकी है। आज 60 मौतें जो है सो बीते 24 घंटे की रिपोर्ट है। तो आप समझ सकते हैं कि किस तरह से मामले लगातार बढ़ते जा रहे हैं। जिस प्रकार से डॉक्टर ईश्वर ने भी बता रहे थे कि जो हमारी नेचुरल इम्यूनिटी है, तमाम साइंटिस्ट इस बात को कह रहे हैं कि नेचुरल इम्यूनिटी और वैक्सीनेशन, क्योंकि अभी तक जो है सो हम 100% वैक्सीनेशन दोनों डोज को लेकर के नहीं हुआ है। तो वैक्सीनेशन पर सरकार का लगातार एम्फेसाइजेशन है कि वो लगातार जो है सो वैक्सीनेशन की स्पीड को बढ़ाएं। और दूसरी बात, प्रधानमंत्री नरेंद्र मोदी ने भी इस बात को कहा है। तो इस ऐसी स्थिति में हमें देखना ये होगा कि किस तरह से लगातार जो मामले बढ़ते जा रहे हैं और लोग जिस प्रकार से लापरवाह होते जा रहे हैं मास्क को लेकर के या सोशल डिस्टेंसिंग को लेकर के। आप मेट्रो में सफर करें, बस में सफर करें, कहीं भी इसका फुली जो है सो पालन नहीं किया जा रहा है। तो ऐसे में अब लोगों को भी ध्यान देने की जरूरत है, क्योंकि लगातार दिल्ली में मामले बढ़ते जा रहे हैं। और बीते एक हफ्ते में अगर हम बात करें तो तकरीबन 95% मामले बढ़े हैं। जी
मनोहर, अगर रिस्ट्रिक्शंस की बात की जाए तो क्या और रिस्ट्रिक्शंस की बात हो रही है? क्योंकि पहले जैसा कि हमने देखा था कि मास्क मैंडेट दोबारा लगा दिया गया है, लेकिन केसेस भी बढ़ रहे हैं दिल्ली में, तो उसके चलते क्या और रिस्ट्रिक्शंस लग सकती हैं अब?
देखिए, तमाम एजेंसियां चाहे डीडीएमए हो या दिल्ली सरकार के हो या एलजी हो, सभी इस परिस्थितियों को मॉनिटर कर रहे हैं। दिल्ली में हालांकि अभी तकरीबन 5% के आसपास पॉजिटिविटी रेट है। तो ऐसी स्थिति में अगर पॉजिटिविटी रेट ज्यादा बढ़ती है, मुख्यमंत्री अरविंद केजरीवाल ने भी और संकेत दिया है कि अगर अस्पतालों में मरीजों की संख्या बढ़ती है, आईसीयू बेड्स जो है वो अगर ऑक्यूपाई होते हैं, तो फिर वो विचार करेंगे जो ग्रैप पॉलिसी है। हालांकि अब तक जो पुरानी ग्रैप पॉलिसी है वो इसमें लागू नहीं हो पा रही है, लेकिन आगे फ्यूचर अगर मामले बढ़ते हैं तो श्योर सख्त से सख्त जो है सो गाइडलाइंस तैयार होगी और उसको जो है पब्लिक को फॉलो करना पड़ेगा।
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.